In this video of a normal cat, landmarks of the caudal wall of the stomach, spleen, and left kidney help indicate the location of the left limb of the pancreas. Ultrasound lesions of the pancreas are frequently not seen even if pancreatitis is present. In one study, 90% of pancreas lesions confirmed by histopathology appeared normal to the naked eye of the surgeon at the time of the biopsy. Therefore, it is important to look for other ultrasound signs that may suggest pancreatitis. The absence of any ultrasound lesions of the pancreas still does not rule out pancreatitis. Near the end of the video, the left limb of the pancreas is located between the caudal wall of the stomach and the transverse colon. The most common cause of hyperechoic abdominal fat in the cranial abdomen is pancreatitis, but it is not the only possible cause. Inflammation of any cause can result in hyperechoic abdominal fat in adjacent tissues. Note the hyperechoic fat around the stomach and intestines of this 15-year-old, 13-pound vomiting border terrier with bile peritonitis. Pancreatitis is present, but it is not the primary cause of symptoms. Bile was leaking from a large cyst in the liver. Did you notice the normal stomach contractions? Note the hyperechoic abdominal fat around the stomach and between the stomach and liver in this 11-year-old Yorkie with multicentric lymphoma. If the common bile duct is dilated, the patient either has a current extrahepatic biliary obstruction or may have bile duct ectasia from a previous extrahepatic biliary obstruction. If the patient's total bilirubin is normal and the patient is asymptomatic, bile duct ectasia is present. Pancreatitis is a common cause of dilated common bile duct, but not the only cause. Foreign body, neoplasia, or disease of the duodenum can also cause obstruction of the common bile duct. Pancreatitis may be present, but secondary to some other disease. The common bile duct is dilated in this 16-year-old, 6-pound cat with inflammatory bowel disease. Total bilirubin was normal. The common bile duct is ventral to the extrahepatic portal vein and does not show color with color flow Doppler. It connects to the major duodenal papilla of the duodenum just distal to the pylorus of the stomach. The common bile duct is not seen in every patient every time. It is more commonly seen if it is dilated due to a problem of the liver, gallbladder, duodenum, or pancreas. Gallbladder volume is often normal in cats with pancreatitis. The gallbladder does not dilate, but the common bile duct does. The common bile duct is ventral to the extrahepatic portal vein. This 14-year-old cat had an enlarged cystic duct of the gallbladder and a tortuous common bile duct, suggesting current or previous obstruction of the common bile duct. Note the hyperechoic abdominal fat around the duodenum. This cat had symptoms of anorexia, weight loss, and elevation of liver values. The common bile duct does not show color with color flow Doppler. Diameter of the common bile duct in this case is 3.3 millimeters. In the dog, the common bile duct and the pancreatic duct connect side by side at the major duodenal papilla of the duodenum. Note the excessive duodenal contractility in this 6-year-old Chihuahua with pancreatitis. The papilla is at the dorso-caudal side of the duodenum near the pylorus. It is often possible to follow an obstructed common bile duct directly to the major duodenal papilla. With chronic inflammation or obstruction, the papilla may become enlarged or remain fluid-filled. The major duodenal papilla is not seen in every patient every time. It is more commonly seen if it or the common bile duct is enlarged due to a disease of the liver, gallbladder, duodenum, or pancreas. In the cat, the common bile duct and pancreatic duct join into a single duct, which then connects to the major duodenal papilla, as seen in this 13-year-old cat with vomiting and weight loss due to pancreatitis. The green arrow points to the major duodenal papilla in this 10-year-old dachshund showing abdominal pain. Did you note the edematous stomach wall when live action resumed? The duodenal papilla connects to a dilated common bile duct which does not show color with color flow Doppler. A lesion of the main body of the pancreas is dorsal and caudal to the duodenum. In this video, the dilated anechoic common bile duct curls ventrally to connect to the duodenum. The common bile duct is ventral to the extrahepatic portal vein. Color flow Doppler shows color in the portal vein, but not in the common bile duct. Pancreatitis of the right limb of the pancreas can cause increased or decreased contractility of the duodenum. Sometimes a dilated and atonic duodenum will be the first lesion seen. Follow the duodenum distally to find a lesion of the pancreas as shown here. Note the irregular thickening of the mucous membrane layer of the duodenum in this 3-year-old German short-haired dog with pancreatitis. This 11-year-old pug has had anorexia and severe depression for 2 days. There is a mixed echoic lesion of the right limb of the pancreas dorsal to the duodenum. The duodenum is filled with fluid but atonic. Wall thickness of the duodenum is 6.7 millimeters, far exceeding the normal maximum of 5.1 millimeters for a dog weighing less than 20 kilograms. In some cases, a patient who has been cooperative during the initial ultrasound suddenly begins to struggle, cry, or try to bite or scratch when transducer pressure is placed over the pancreas or right upper quadrant of the abdomen. It looks like this on the ultrasound from a 13-year-old 12-pound terrier with pancreatitis and a cystic mass caudal to the stomach. The patient is trying to tell you something. Do you hear? The patient did not struggle during other parts of the exam. Pain relievers are appropriate. Pancreatitis can cause localized pain from transducer pressure, but it is not the only cause. Localized pain in the right upper quadrant can also result from gallbladder disease, inflammatory bowel disease, neoplasia, and gastrointestinal perforation with localized peritonitis. Did you note the thickened muscularis layer of the stomach indicating gastritis? Did you see the pancreas lesion,